Thank you all for being here today. You're the, thank you. You are the third installment for this. So by now, hopefully we actually know what we're talking about. We'll try and be brief.
That was a statement.
And I took it as such. I know. Thank you, Cotton. My goal is to exceed your expectations. Those that don't know me, if this is your first time to be in here, I am the CEO, Randy. The purpose of these meetings is for y'all. It's educational for you, I hope. If it's not, I'll put it back on you because we're trying to talk about what you want to hear, albeit briefly. And so when we send these invitations out, we really do want your feedback as to what do you want to hear. So we haven't gotten any feedback about this one. It's probably, I guess, 3 town hall meetings now that we've had that we haven't received any feedback. So I'm taking that in the positive, meaning that we are absolutely talking about the exact things that y'all want to hear and no more, no less. So if that's not true, let us know. We'll open it up at the end for questions. So if there's something that you thought we were going to talk about that we did not, that would be the time to ask. Then we'll really try and get it caught up in the 4 o'clock session, which is the last session, and then have finally had this comprehensive discussion in town hall meeting. So for me, first thing I just want to talk to you about is the Childhood Development Center update. It's good for some of y'all, but still looking for some additional funding there. Robertson County Trust gave us $1.1 million to build it. The Stokes-Brown Trust gave us $500,000 additional to build it, but we're still about $500,000 short. So we've applied to the Drawn Foundation for another $500,000. They should be making that decision this month and getting back to us on that. If they are able to come through with the additional funding, then we'll break ground and we'll build this thing. If not, it's okay. The management company, which is called Bright Horizons, who's going to be managing this Childhood Development Center, also has a fundraising arm. And so they'll work with us to begin a community fundraising event. Community fundraising for a Childhood Development Center that you can't send your kids to, y'all can, but they can't, is probably not going to be the most favorite community fundraising item that we could potentially put out there. It's doable, but it'd be pretty tough. So we're really hoping that we don't have to go down that path. So it's difficult to go over to Electrolux and go, hey, we think that you ought to support NorthCrest Medical Center and help us build a Childhood Development Center, but you can't send any of your kids to it. All right? That's a fun message. I'll let Tiffany go ahead and take that message out there. All right. Okay, so, but in terms of some growth opportunities, if any of y'all have gone out to Pleasant View recently, where our location is, you'll see a whole bunch of dirt moved around. Right now, a whole bunch of steel beams laying on the ground. So those need to eventually be put together and form a building, 6,000 square foot medical office building. We're a little bit behind. We're behind because of the weather. The snow and the rain have greatly slowed the building down out there. So at first, when I first mentioned that we were going to be building this building in Pleasant View, it was okay that it was going to take a little bit of time because the Lowe's distribution center is driving a lot of the growth in that area. Well, it wasn't going to be fully staffed until the year 2020. Well, now they're ahead of schedule. They could potentially be fully staffed by the end of this year, definitely going to be fully staffed by the year 2019. So now I need to hurry. And so the idea there is that we're taking Dr. Pennington in the current building and we're moving him over into the new medical office building. And then in Dr. Pennington's space, if anybody has ever been in his office, it's actually designed and it looks a lot like an urgent care walk-in clinic anyway. So we're going to do a joint venture with Vanderbilt for a walk-in clinic right there. And then Star Physical Therapy is thinking that they may want to move into the new medical office building as well, so we can do some additional things with their existing space. And so we're really trying to expand out the capabilities in that location. Really trying to keep pace with the 600 new jobs that Lowe's is creating, but then again, there's a lot of other people are just moving in there. So it's just a big focus for us. The other thing that we've done is opened up a new office in Clarksville. We offer the same services that we did in the office in Sango, but we've gone further into Clarksville into a larger space. It's also a much more prominent space. So I've joked with the other groups, if you ever really want to see us shine, literally, go out there in the evening or night. It is a very prominent location with a very nice, well-lit sign that's difficult to notice that NorthCrest has not gone in there and planted an absolute flag right in the middle of Clarksville. It has been very well received, but it's the same services that we had in the last location. So that's orthopedics, ENT, and general surgery. So it's a bustling office, lots of really good feedback about that. So we're excited about it. We're excited about that enhanced presence and really just focusing on that I-24 corridor. You might ask, are you ignoring White House? The answer is a little bit, not meaning to, but if you look at the competition that we have on I-24, you really just have Skyline at the bottom of the interstate, and then you've got Tenova, Clarksville sitting at the top. There's really not a whole lot in between. There's Ashland City, but they've got a small little hospital, and it's not really in a prominent location. So from a competitive landscape, it is easier to build out on that I-24 corridor because there's less competition, and the competition that's there is not very strong. So we do very well in that market. If you look on I-65, which is where White House is, which is a booming area, but at the top of the interstate, right at the state line, you've got Franklin, Kentucky sitting there. You've got Portland with a hospital. You've got Hendersonville, Sumner, Skyline, and then us. It's a tough little market to try and get into, and it's split a lot of different ways. So we're not abandoning it. We're just trying to look at it and see how best to tackle it. And when you have limited resources, you really don't want to go where the biggest fight is. If there's an easier fight to be won somewhere else, then that's what we're doing. So that's the idea and what we've got going on there. And just wanted to tell you all a little bit about it. So any questions about any of that? All right. I'm going to turn it over to the CFO, Ms. Kim Pridgeon.
So good afternoon. So we're in the middle of January, right? What did we do for the employees, for full-time employees, starting January 1st regarding your health insurance?
Extra 20% discount.
Oh, I love it when you sit up front. Extra 20% discount. So all full-time employees get a what? All full-time employees get a what? Oh, come on, people, work with me. We're on camera. Thank you. So embarrassing. You aren't even paying attention. 20% discount. The second part of that is if you have Aetna health insurance, our hospital plan, what else happens for you?
You get the Aetna discount.
Your dependents get your Aetna discount. So we have rolled that out this year. It kind of makes me sweat when I think about it. But we've listened to you, we've heard you, and we hope you'll find that a high benefit for us at NorthCrest now. So it's all full-time employees, medical center, and physician services. Now, we don't offer a discount on physician services because what do you get to do now anyway? You can go see the nurse practitioner for free, can't you? So we already have something set up over on that side for free. So on the medical center side now, you get a 20% discount for full-time employees, regardless. And if you have the Aetna health insurance hospital plan, you get 20% off your dependents. So yay, 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 yes. We listen. Y'all talk, we listen. See, when you don't tell us what to talk about, we got to find something. The other thing I want to do is dental vision. You might have dental and vision. Did you see an increase this year? No. 4th year. I would like to publicly thank HR. They worked very, very hard. Not only do we have to transfer to a new company, but they kept our rates the same. Got the best benefits, and we still have the same rates. So that's pretty incredible, isn't it? So if you see them, say thanks. Last thing. Did anybody notice their check this last time? What happened?
More on it.
You got more on it. Yes, you did. And why do you have that? Who's looked? Trump. That's right. Trump. You got a tax break. You got a tax break. So you should see more in your check. Now, this is the cautionary tale. Nobody knows what that means. I can't tell you whether you're going to be paying more next year or not. The IRS isn't even ready. They haven't even rolled out the new stuff yet to figure it out. So in a month, give them another month. On the IRS website is a way that you can put in your information and figure out how much taxes you'll owe under the new plan. but they're not ready for you yet. I highly, highly, highly recommend that you do that because we don't know what it is. I would hate to think that anybody's taking all that money and then next year we still have to pay a portion of that back and you're not ready. So if you have an accountant, so my family's already asking me, and I'm going, I don't know yet. I don't know. We have to figure that out. Talk to your accountant, but also you can go on the IRS website. When you first started here, you filled out a what to tell how you would withhold your taxes? W-4. Guess what? They haven't even rolled out a new one of those yet. But you can go ahead and change your exemptions if you want through HR. So Michelle Stites is the one who has that. They're actually out on the board. The old forms are out in front of HR if you want to check that. But that's where you'll go change that once you figure out if it's going to benefit you or not, or if you need to change it. Because remember, what you've done in the past is not going to be the same for next year. So there's my cautionary tale of what our taxes are going to do for you. So health insurance, yay. Dental and vision, yay. Tax return, we're not sure yet. Any questions for me?
Good morning, guys. My name is Chris Locke. I'm the Vice President of Business Development. Thank you for being here today, and I will try to cover as much as I can, so listen fast, okay? And I'll start off by saying thank you for all the folks that worked on the 20% discount for our health care. When you think about what's going on in healthcare, and since 2005, there's been a 134% increase in the dollars that come out of all of our pockets, and that's across the nation. So the money that comes out of the consumer's pocket is 134% higher today than it was in 2005. And so that 20% discount for us is frankly quite meaningful. I mean, if you have the high deductible health plan, which I would assume that most of us do, the reality is you could spend $10,000 a year out of your health care quickly. And so 20%, if you get those services here, makes a difference. So thank you for that. Secondly, I'm trying to figure out how we're going to make up that 20%, right? I mean, we've got to grow to make that up. So let's figure that out. So I'll start off with a reminder of mission statement for business development. Our mission is to develop revenue generating growth through new and existing lines of service, by our relationships, by effectively communicating the quality experience of NorthCrest Medical Center to our internal and external customers. All right? So that's a lot. Internal and external customers, what's that mean? That's everybody that hands something off to us is our internal customer, right? Our physicians, our other provider offices, our referral staff, even some of the agencies that send people our way, and frankly, it's each other. Our external customers, that's easy, that's the consumer, right? That's our patient base. Those are easy to find. So the last time we talked, we told you we were going on an all-out plan, one for territory management expansion. We were also going to dictate on some surgical volumes and work with our sister agencies and other healthcare facilities to try to increase our referral base. So I'm going to give you quick updates on those and then talk about the next 6 months. And then I'm going to end with like a challenge because it's Monday and it's 2 o'clock and, well, we just need a challenge, right? But just to forewarn you, it'll probably end with a little bit of a, okay, just so we know. I'm just saying, right? Let's just be transparent about it. All right, so just a couple of examples. Territory management. I want to tell you that in business development, you'll probably see me less inside the house. You'll also probably see Rachel and Debbie as they go out and do their functions as liaisons and development folks less than you have in the past. I will tell you the expectation for rounding with our primary service area and our secondary service areas has increased dramatically. When I say increased dramatically, I mean 15 to 20 a day. So primary service area every 2 weeks, secondary service area quarterly, with a separate, probably monthly phone call and quarterly rounding on our sister facilities. Even if they take some of our business and give it back to us, we're still going to round on their case management to try to get that business back to us. That details out a couple of things that have worked well in our favor. To highlight a few of them, I'll say that this last couple of months, I say about a month and a half ago, we actually went and had lunch with all of the case managers at Centennial. So we were able to visit their case management meeting and discuss the services that are here, because the reality is healthcare is full of people that want to do best for a patient. There's nobody in this room that doesn't want the best for that patient. And if that patient's coming from this area and they can get those services in this area, the reality is they're a lot more apt to be compliant, and they're more apt to have family involvement. And those case managers at Centennial want that too. But sometimes when you get that patient down in Centennial, You're thinking about the next centennial physician. You're not thinking about sending them back up to Robertson County. So as we continue to engage with them and continue to notify them of the services that we have and remind it, we'll start to see some reverse referral. We're trying that in several different areas. Another opportunity that came to us, and Mr. Davis went and met with the entire med exec team at Blanchfield at the Fort Campbell base. That's a phenomenal opportunity to build relationship and to drive business, particularly servicing our veterans here in this community. The reality is they need coverage and we need the business. So it's those type of opportunities that help us drive through relationship to grow. Another relationship builder that we have is we're actually targeting our GI specialists that we refer to currently. So in looking at our current referral base with physician services and our physicians up here, if they're referring out to GI, what we've done now is reached out to them to talk about services that we have so that we can again get the reverse referral once it comes down to them having surgery or any other services that we do here. By centralizing that referral base, what we have is the opportunity to build meaningful relationship to try to get that business back to us. And I will say this, if we kind of disperse our referrals for GI, and I'm just taking GI, it's anything, and we send it out to 30 different GIs down in Nashville, they are not thinking about sending it back to NorthCrest Medical Center. That's just the reality of it. But when we have those meaningful relationships and we drive that business line, there's a good opportunity, and we've seen some reverse referral from that already. So it's a good opportunity for us for surgical growth, and it's an opportunity for us to build meaningful relationships just through good territory management. All right? So territory management also means expanding our territory a bit. Mr. Davis brought up Pleasant View, and he also brought up the Clarksville market. I call it Sango anymore, and I really can't do that. It's actually Sango Clarksville market, because it is smack dab across the street from Publix and right down the street from Chick-fil-A, and if you can find a better spot than that, I don't know it. Just telling you. It does light up like a Christmas tree at night, and it has been extremely well received, not only from a retail environment, but also from just expanding those services up there. When we talk about sister agencies, I'll use one example from Montgomery County. Just this last week or week before, I can't remember, we actually were represented as the only healthcare provider at a Montgomery County opioid panel to try to talk about what to do about opioid abuse in Montgomery County. That was attended by 200 of the community leaders. All of their county commissioners were involved. They were actually in attendance, and the panel was the mayor, the chief of EMS, the fire chief, chief of police, the sheriff, the district attorney, and a couple others, and us. I will say that their local healthcare facility was not represented. We were there. So that's another opportunity for us to expand our marketplace and build our brand as a healthcare provider for that county. Internally here locally, to give you a couple examples of what that means from a sister relationship through our local health council. So the Robertson County Health Council was kind enough to give us a $1,000 grant for Harmonicas for Health. And Harmonicas for Health is a partnership with the COPD Foundation to actually work with folks with COPD to teach them how to play harmonica. It's actually just a type of rehabilitation that had great success. One, because I think it's fun. Two, because it's pure accountability. And three, because all it's really doing is teaching pursed-lip breathing and some rehab. So great success with that. And just by show of hands to see how poor a job I did at marketing that, how many people knew about Harmonicas for Health when it was going on in December? All right, so maybe half. That's probably not good enough. I will tell you it's had great response, and that has actually grown into further relationships. Who's the high utilizer of healthcare? Our seniors, right? It's our geriatric population. I will say, I'm using the term of 10,000, it might be up to 15,000 based on best numbers, COPD sufferers just in this county alone. So we have found a volunteer who lives in Robertson County, who for the last 2 years has been driving to St. Thomas Rutherford to teach Harmonicas for Health classes as a volunteer, who was actually going to be starting a Harmonicas for Health class in our local senior center. So we're very appreciative of him, and we're very appreciative with Health Council and COPD Foundation to drive this into our community. It's also, in March, going to start at the Ashland City Senior Center, which has 1,100 members. We'd like to see this push forward also to White House and into Montgomery County. I can see a time within 2 or 3 years, let's say we've got 1,000 people that are going through this. That is a small increment of the folks that actually need it, but a fantastic opportunity for us to have the intention of very affordably and very effectively aiding people with COPD. And when those people need services, they think of us. It's just a branding opportunity that actually does some good. So I'm very appreciative of it. Another way to do it is actually through the Health Council and through the Governor's Healthier Tennessee program. We are jump-starting wellness programs and preventative measure programs through faith-based organizations and industry here in Robertson County. Casey Blue worked really hard on this, and what you'll see is a jump drive. It happens to say NorthCrest on it. On this jump drive is a bunch of information that can be utilized by the up to 75, I think it's about 75 people that actually signed up. That's different industries and churches here in Robertson County. And each month there is a flyer for preventative services that they can utilize to email to their staff and also put on their bulletin boards and used in their preventative measure plan. This is a great opportunity for us as a business development office to actually look for those shepherds of people. And as we find those shepherds, let them know what information is available and what services are available here at NorthCrest Medical Center. So that's some of the things that we've been doing. I think I'm leaving something out, but I'm gonna move on. So industry. So let me tell you where our industry is going. And you're gonna hear about this in the news. You're gonna read about it when you read your professional literature. This industry is moving towards consumerism. The problem with saying that we are moving towards consumerism is nobody really knows the definition of consumerism, right? You can almost say it means anything. Is it more technology? Is it better access? Is it cheaper prices? What is consumerism? What's it mean to you, right? It's relative. The reality is no matter what your definition is, it absolutely means that the consumer is making the choice on where and if they actually get healthcare services. I have often felt like Chicken Little because for 3.5, 4 years I've been talking about high deductible health plans, what's it going to do, high deductible health plans, what's it going to do. And although I hate to sound like Chicken Little, the reality is it's true. High deductible health plans are here. This industry has changed. Healthcare consumers are making the choice on whether or not they're going to get care, and if so, where. It's not like it used to be. It has made a marked difference into how facilities and physician offices operate. I would say most of us have a high deductible health plan. Most of us were really excited to get a 20% discount. Our consumers face that same choice every single day. So when we talk about an industry-wide, let's talk about why this is a little bit. So this sits on my desk and it's a nice little motivator. So since January of 2010, 82 rural hospitals have closed down. Now, we're doing well. I don't want to scare us, right? I don't want to be Chicken Little, but I'm also not going to be apathetic and be the guy that says, hey, let's just keep doing what we're doing because it's going to work forever. That's a sure way to fail. And when we see these kinds of numbers nationally, we do have to do things differently. We have to be promoted for change. So 82 hospitals have closed rurally since 2010. Here's why. Average operating margin in 2015 for rural facilities, 0.2%. Not 2%, okay? Not 0.2%. Average operating margin among urban hospitals, these are the ones that make all the money, right? 4.4%. Now let's put this into perspective. If you went into a bank, tried to get a loan with an operating margin of 4.4%, or hey, I'm going to be really good at what I do, give me a business loan to get started, and you say, hey, my operating margin is going to be 4.4%, you're not going to get your check. That's just the bottom line of it. If you went in and said it's going to be 0.2, they would laugh at you and maybe kick you, and you still wouldn't get your check, right? But it's 0.2%. So what does that mean to us? That means as we expand territories and we develop new relationships and we have new providers that send us business here and we have new service lines or existing service lines that we all engage in to make grow, every single encounter is absolutely important. We will have to be the provider of care of choice because it is the consumer that is now making that determination. Other areas of our industry will change. Mr. Davis brought up Pleasant View and that I-24 corridor, their business plan will change. We'd better capture it while we can. And how we do that is we become excellent at what we do. And let's talk about excellence for just a second, and then I'll shut up and get out of the way. Let's take just a simple encounter that we have. Let's say you're coming to get an MRI, right? Pretty simple encounter. If you're the consumer, if you're the patient, there's probably 7, 8 things that you would find critical to success for that visit to be successful for you. Registration was communicative and kind. You didn't wait a long time. The tech was knowledgeable and nice. You were discharged and got your results appropriately, and you understood your bill. Is that fair? I mean, I would say let's just do 5, okay? That's a pretty easy 5 things to find, that if you're the patient, if you're the consumer, you want those things to happen. And let's say we did each one of those things 95% of the time appropriately. That's an A, right? 95%? That's an A in every book. Would we agree? Well, that's a trick question, of course. You know that. In our eyes, if we are doing each one of these functions, 95% of the time feels good. It feels like an A. But if you're the patient and we only do one of these things 95% of the time, it's actually the total experience is about 76, 77%. And in anybody's book, that's not a passing grade. If Best Buy, if you did business at Best Buy, and they only got it right 76% of the time in your eyes, you probably wouldn't go back. And it's the same with healthcare. I say it a little differently than consumers a lot of time. I talk about it as being a retail environment. But that's where we are. That's where we are. So I really like to end on a down hum note, right? And I warned you early. I'm not trying to scare us. I'm just saying the level of excellence and the competition that's available today is greater than it has ever been in healthcare. And we, regardless if you've been in this a year or 10 years or 30 years, this industry has changed. And we've got to change with it. Anyway, what questions?
Thank you, Chris. How y'all doing? Y'all staying with us? Back in 2016, we engaged upon a journey for zero patient harm. So I kind of wanted to let you know, I let you know last January how we ended out the year of 2016, and I would like to let you know how we ended out the year in 2017, and kind of how that compares to 2016. Hospital-acquired C. diff. In 2017, we had 1 case of C. diff that was hospital-acquired. In 2016, we had 3. So we've decreased that number. Central line-associated bloodstream infections, or CLABSIs. In 2017, we had 1. In 2016, we had 0. Surgical site infections. In 2017, we had 7. That's up from 5 in 2016. So we actually had 2 more in this past year than we did the previous year. Catheter-associated urinary tract infections, or CAUTIs. We had 1 hospital-acquired CAUTI. In 2017 and 2016, we had 2. Ventilator-associated events. These are not infections, but these are events. We had 1 in 2017. We also had 1 in 2016. Medication errors causing patient harm. In 2016, we had 0. And in 2017, we had 1. Facility-acquired pressure ulcers or pressure injuries. In 2017, we had 3. In 2016, we had 7. Falls with injury. In 2017, we had 0 falls with injury. Yay, Amanda, right? And in 2016, we had 3. Obstetrical deliveries less than 39 weeks. In 2017, we had 0, and in 2016, we had 0. And then venous thromboembolism, in 2017 we had 0, and then in 2016 we also had 0. So these are the 10 indicators that we have identified as we should have 0 patient harm. Once again, that's our goal, is to get to 0 patient harm. I do believe that we are the best in the state, if not in the nation, as far as all of our raw numbers. CUSP teams in our quality data and the way they report, they're reporting percentages. The way we report is in raw numbers for our 0 patient harm. We report in raw numbers because we think that every patient is one too many. And we want to drive that number down to 0, no matter how many patients we have. Are there any questions on our 0 patient harm? Okay, I'd also like to talk to you for a minute on our ARC survey. That's the safety culture survey that we all take every fall. I want to thank each of you that participated in that. We had a 70% participation rate. 60% is considered a good survey. So we exceeded that, and I thank each and every one of you for filling that out. And we take those results, and they're collectively put together for us, and we look at those and how they compare to year. And we also look at how we compare to nation. We ranked higher than the nation on all of the indicators. However, we still see that there's areas of improvement that we can still improve upon. One of those being communication between departments. So our goal in clinical leadership for the upcoming year is how do we improve that communication between departments when we're transferring patients between departments? How do we improve upon that for patient safety? And that's one of the things you'll see us working on throughout the year, as well as all the CUSP teams that are still working on the 0 patient harm. Do y'all have any further questions? Comments? Okay, Mr. Davis?
Two-handed operation. All right, so that's it in terms of everything that we had listed to cover. There were 2 questions that have been asked previously. One was, when's the construction on the road going to be finished? And so if y'all would go out and do the research and bring me back that answer, I'd appreciate it. It's already supposed to be done, so I don't know. But we will have a traffic light at the hospital, and then another one right over there by Walmart. So we'll have 2 lights, and then y'all can complain that you can't get through Springfield because of the stop and go traffic because of all the lights. But that will be done. And the other was that a suggestion box for topics that we would talk about at town hall meetings. You can actually use the boxes where you put the star cards. You can put suggestions in there. You can put whatever you want, and HR gets them. They'll look at them and get them to all the right people. Then, tongue-in-cheek, I said that we actually had announced that to a group of employees, and then we were told that they were in view of a camera. So I want you all to know that if you're so worried about anonymity that you think that I'm going to go back and look at a camera video to see when and who put a suggestion card in there, you're crazy. So it ain't going to happen. So we're not going to move the suggestion boxes away from cameras, because that would actually show you where we have places without cameras, and that would probably be where some event would occur that we would have to put a camera there, and then we have to move the box again. So you can use the star card things for suggestions if you have them. Any questions, comments? Have we touched on everything that you expected to hear?